Now, the National Command Council, the Coronavirus Command Council, met yesterday to discuss the way forward for the country in dealing with COVID-19. Cabinet is expected to make an announcement on that issue. And the question is, could we be moved to level 1 perhaps by tomorrow? Let's take you to Ayanda now, who will continue this discussion with Health Minister Dr. Zweli Mkhize, and I'll join him in a moment.
That's absolutely right. Thanks very much, Michelle. So the Health Minister, as you heard, Zweli Mkhize, now joining us to help us understand and unpack some of the considerations to make as we chart what many feel is a second phase of our response to COVID-19. So, Minister, thanks very much for your time and welcome to the AM report. So let me start by just asking frankly as a start, are we ready for level 1 of the lockdown?
Well, I'm sorry, I think our reception may not be that great, but we are at a point where we see the numbers are coming down, and in fact we can confidently say that we're over the surge and that we are seeing South Africa really getting low numbers of admissions in hospitals, low numbers of positive cases, and lower numbers of deaths if you compare week by week. And we believe, therefore, that we're over the surge. And that's really a very important thing for us because it means we have to adjust our lives now to try and get closer to normality.
Right. And, Minister, you know, many people are wondering whether this means that a level 1 lockdown is imminent. Let me get your take on that. I mean, are we moving to level 1 of the lockdown, perhaps as soon as even this week?
Well, that gets determined by Cabinet, and the President will announce once that decision has been made, and I'm not, at this point, the decision has not been made. There's still going to be Cabinet meetings. The President has gone through quite a lot of consultations. We have, as Health Department and provinces, made our submissions. Various departments have also come together to make submissions. The provinces have also been consulted. And so what remains now is for Cabinet and the President to give us a clear line of march going forward. So I think we'll know all of that as soon as the President has made the announcement. But we are quite comfortable that the numbers are such that we have to look at certain restrictions being eased, understanding that there might be restrictions that will be part of our lives as part of a new normal as we move into the future. There are things that we might probably be able to do, but there are things that we shouldn't be doing until we have got the vaccine. So there's a new normal that we start to consider.
Morning, Minister. It's Michelle Craig here, and I want to ask you about the declining number of infections that we are now seeing in your daily updates. Every day those numbers are well below 1,000 new infections. Minister, do we know yet what the reason is for this? I mean, is our testing still at the level that it was a few weeks ago?
The testing is fine, although we're testing fewer now because when we centered the testing criteria, it was focusing on people who were exposed and infected and coming to hospital. We now found that pool of patients has actually declined, and that's what makes our numbers to go down. But when you look at the proportion of those who are positive inside that particular batch of specimens that are tested, we are finding that the positivity rate has decreased. We were as high as about 27 to 30% in the middle of June, early August. And then we have now found that the number has decreased from about 11 to about 9.8%, which means that for every batch that we are testing, the number of people who are positive is much less. So we're comfortable with that. We are still going to increase the numbers of people to be tested because we're now going to more of a surveillance and surveillance mode that will help us to monitor new emerging infections.
Right. Minister, there's also talk now of perhaps many people in our population having had developed herd immunity. I mean, in some aspects, that's been touted at around 20%. What are the implications for that if it is true? I mean, I imagine it also suggests that we won't move to a hard lockdown even if we were to experience a second wave of infections.
Well, there are two things which I think you need to take into account. The first of those is that we don't know for a fact how many people would have had immunity at this point, but we must say that there are more people with immunity than the numbers that we have recorded as being positive, which is basically because too many people were asymptomatic and they would have generated immunity without even going to a hospital. So that's one thing that we know. And that there is a study that's been done on what we call Sentinel study, which is a survey done on people who are coming to hospital for various reasons. They found in the Western Cape that the number of people with immunity would be about 37 to 40%. And in the Gauteng area, the figure is about 27 or 28%, thereabout. Now, that is just a record of samples. It's not a proper reflection of what's going on in the community. So we wouldn't know how many people have got immunity, but we must say that there would be some who would have developed it. It is not safe to make an assumption that all of us are safe, because even if those were the numbers that had immunity in the community, 40% or 30% of people who have got immunity means there's 60% who are exposed, where the risk of a whole new epidemic can still break out amongst them. So it means we have to remain very, very careful still.
Yeah, and as you talk about us remaining very, very careful still, Minister, are we talking about, and are you talking about, as part of the Coronavirus Command Council, the possibility of a second wave?
We think that the second wave can never be ruled out. It depends on how we behave. So if we, for example, decide that we are going to be complacent, drop all the masks, drop the distancing and hand sanitizers, hand washing, we may suddenly find ourselves having a huge wave. We've seen this wave coming out in the US. It was decimating the second time around. It was much bigger than the first one. Spain has actually shown that it had controlled the situation and everybody was happy, and all of a sudden they're seeing the resurgence. We've seen other countries, Iran, we've seen Korea, we've seen a number of countries showing that this resurgence is still possible. So South Africa can't be different. We must always keep in mind that as fellow South Africans, we must manage all of these containment measures so that until we can get our vaccine in place, because it means in between we might actually get an explosion. But right now there are no immediate indications, but we really can't say that it is not possible to get a second wave.
Right. And Minister, as we make those considerations, we're also obviously moving into much warmer weeks, days, possibly months. I wonder how, if at all, that should change how we respond to this pandemic. I mean, many people are already speculating about, for instance, whether or not COVID-19 is affected by temperature to begin with.
Well, South Africa has got higher temperatures even in winter than some of the Western countries. So some of our winters are as good as the summers in some of the other parts. So we must just be cautious about that. The point is that what you can definitively say is that the surge is over, and we've had a continuous decline for the past 6 weeks in some of the places, some of the provinces, of even 2 months. So that means, therefore, that we are over the surge. Some of the experiments that have been done have actually showed a correlation between exposure to sunlight and the survival of the virus in saliva. And this experiment indicated that the virus could be dead within 7 or so minutes if exposed to the sunlight. But in some of the areas, if it's in the darkness, it can last as long as 24 hours or even longer. So it may well be a factor, but before there's authoritative research that confirms it, all of it remains postulations that we really can't hold everything on. We must just say there are basic precautions that we know work, and let's stick to those.
And Minister, I suppose you're now most likely in the phase of your work where you're going to be taking a look at how things have gone over the past few months in our country. And I just want to reflect on the Business Day's page 3 today. And its article is again talking about, we had devastating projections of the kinds of infections we were likely to see in South Africa. That was at the start of the pandemic. And in many respects, those numbers in reality have turned out to be quite low. And this article talks about, a survey that was done in the Western Cape that in fact found that 40% of pregnant women and people with HIV, those who were using public health facilities, they were actually found to have COVID-19 antibodies, when in fact the infection rates in some of those communities like Khayelitsha, Klipfontein and Mitchell's Plain, those rates were actually officially quite low. So are the numbers that we're looking at, Minister, only the tip of the iceberg actually in terms of infections?
No, not quite, actually. I think COVID-19 behaves in the same way in every country. In the first instance, you can't test everybody. In the second instance, there's many people who will be positive without knowing because they've got no symptoms, or they have got mild symptoms. And of late, others decided, listen, I'm not going anywhere, I'll stay in my house, and therefore they actually got the infection without being recorded anywhere. We initially thought this was not possible, but we actually heard about this happening in the UK, in the US, and it's happening everywhere. So we didn't behave in any way different to what the rest of the world is doing. Secondly, whatever number we report today as being positive, it's a good indication of the trend of the infection. It is not a good indication of the totality of the people who are infected. And therefore, what was done in the Western Cape, effectively, they actually went to check the antibodies on women who are attending antenatal care. They went to talk to some of to get specimens from people who are attending hospital for different other reasons. They did the same in the Gauteng area. In the Western Cape, the figure was as high as 37 to 40% of people showing antibodies, which means they had immunity. And then in Gauteng, the figure was around 27 to 29%, which also is showing that it's higher than what we had initially recorded as people who were positive. Now, we're not surprised about that. We're only surprised by the level with which those numbers are indicating to be higher. So all we need to do now is to do a proper survey which covers all South Africans. Then we've got a better indication, because people who come to hospital are not a reflection of everything that's happening in the society. There, for some reason, might be a concentration of a particular type of people. So you can't make a generalization about it. But we do accept that there will be more people with immunity than those that have been recorded to have been infected.
Minister, I'm conscious of time, and I know you do have a meeting to get to, but before we let you go, for better or for worse, one of the really contentious issues around government's response to the pandemic involved the sale of alcohol and cigarettes. Cigarettes have finally been allowed now during this pandemic for the first time, and I'm interested to find out whether government's assertions that this would have an adverse effect on, the pandemic itself are proving to be true. Are we seeing those trends among people testing positive that are also smokers being the ones most adversely affected? And perhaps you can also reflect for us on how alcohol consumption has affected those hospital admissions.
Well, we don't have a direct study that's indicating the impact of COVID on tobacco. When we dealt with that issue, we're dealing with the general principles of the impact of tobacco to the lung surfaces and how it compromises the lung functionality. So that becomes our consideration, but we don't have a study that says if you smoke so many cigarettes, you then have such a chance of getting infected with COVID. Now, with alcohol, the issue is about the social behavior, where people who have got influence of alcohol may not be able to control their behavior and therefore may spread the infection. But our biggest issue was the pressure that the unnatural, or let me say the trauma, the violence, the interpersonal trauma, the motor vehicle accidents, what that did to our nursing staff, to our medical staff, to our ICUs, to our casualty offices, really distorting the attention that is needed for those who have got COVID, but taken away by people who are coming with blood, and because when they're bleeding, they're in emergency. We needed to get that sorted out. So, in effect, we have now been able to get over the pressure of the alcohol influence on the hospitals, and therefore some of the restrictions would have to be eased. To what extent, of course, that has not been decided, but that will have to be eased at some point. We do need to have a conversation, though, as to why South Africans would be, ingesting so much alcohol and so much of trauma, so much of violence, so much gender-based violence can be associated with the influence of alcohol and social devastation, the breakup of families and personality disorders and so on. That we need to face as a different issue, which is not a COVID issue, but it's a societal challenge.
Yeah, absolutely. Minister, we always like to end off our interviews with you here on the AM Report by asking you how you are doing. It's been a harrowing few months for you and the rest of the team there. You planning to take any leave soon, Minister?
No, thank you. But I want to say that I think there's a lot of relief from the fact that we've gone through the surge. I've just been checking that I've not been talking to some of the MECs as frequently as we've been doing. And I think there's a sigh of relief amongst many South Africans. But we want to say thank you for all the support from the President to the Cabinet Ministers, to all the leaders of various organizations and faiths, and to the media for all the work. We've actually worked together at this point. So we really want to say we hope that we stay like this and never get worse.